Living where we do, it's inevitable that we will run across a snake. Now, if you have a pet, it can be something that's even more common. Here with some summer pet safety tips is Spivey from University Veterinary Hospital. Good morning, Dr. Spivey.
Good morning. How are you?
I'm doing pretty good. And so you wrote a blog on this, and you mentioned that there's two common types of snakes. What kind of snakes do we have here?
So in our area, we're looking at both coral snakes, which you don't actually see very often, which is a good thing because they're pretty dangerous. And then you see the pit vipers, which we commonly think of as copperheads, cottonmouths, and rattlesnakes. And that's generally the types of snake bites that we're going to see here in this area.
And the reason why we mentioned those two are because the toxins, I believe you had said, are different, right?
Much different. One's a neurotoxin, which is the coral snake, and one is a hemotoxin, which is the pit viper venom.
Okay, so now that we got the snakes out of the way, we want to talk about your pet at home. What happens if they do get bit by a snake? How do you recognize this?
So the first thing that you're going to notice is your pet's incredibly painful. Snake bite really hurts and pretty profound swelling. And usually you're going to see the wound or the swelling on the face or the foot as they're playing with the snake. You can sometimes see the fang marks, but oftentimes you have to shave to actually see that. So usually it's the swelling and the pain that's going to give you the key to that first and foremost.
And as a pet owner, is there anything that you can do in that moment to kind of treat for this?
The fastest and the best thing that you can do is get them to the veterinarian. A lot of the old things have kind of fallen out of favor. Don't place a tourniquet. Don't try to suck the venom out or make a cut into the skin. Just get your pet to the vet.
Okay, so now that we've gotten the pet to the vet and we're at UVH right now, what are you guys doing to treat for the snake bite?
So the first thing that we want to do is to draw a little bit of blood work because the main thing that the venom is going to affect is your clotting times, and that can in turn infect your internal organs and can be pretty serious. So we're going to check the clotting times, maybe some blood work values, but we want to get IV fluids on board. We want pain medication, antihistamines, and then sometimes antivenin. And we use some of those markers when you use a lot of that blood work to determine, do we need to actually treat this pet with antivenin? Because it can also be a problem as well as anaphylactic reaction. So we want to make a judicious call on whether or not to use that.
And when you guys are doing the treatment, what's kind of the time frame? I know each case is different. Time frame for recovery time and treatment for this.
Absolutely. So the most important thing is getting it done quickly, 4 to 6 hours after the snake bite happens. But usually they're going to be in the hospital for 24 hours or so, depending upon the severity of the bite. But they actually recover pretty well if the proper means are taken quickly. And usually they'll go home. That might have an area on the wound that can create an issue later, but it usually heals okay by itself.
All right. Well, these are a lot of details. We're going to have this information on our website. We're going to have a link to the blog that Dr. Spivey wrote. It has a lot more details on there. Thank you so much for joining us.
Absolutely. Thank you.
Definitely. And we want you to stick around.